Once the patient name is selected, the initial test prep screen will appear. Take a couple of seconds to verify the patient's name and ensure the appropriate ear is selected. When the probe is placed into the patient's ear, press the Start button to initiate the probe check. This step automatically evaluates the quality of the probe fit in the ear canal to ensure a quality fit and therefore a reliable test. The probe check verifies the seal, the stimulus level in the ear canal, and the external noise in the testing environment. A check mark for each parameter indicates that the fit quality is acceptable for testing. If the probe fit is not acceptable, reinsert the probe tip, quiet the baby, and attend to any acoustic noises in the test environment if necessary. It is possible to stop the test at the probe check screen if adjustments are required. When the probe check is successful, the Novus will move automatically to the testing screen. The testing screen displays a few key pieces of information to observe. Bar graphs in the center of the screen will show the progress of each test frequency toward a pass result. The red bar indicates the right ear and the blue bar indicates the left ear. When a frequency has passed, the bar will turn green and there will be a check mark indicating a pass result for that frequency. A horizontal noise bar with a green check mark indicates that the noise is not interfering with the evaluation. It is possible to pause the evaluation to reseat the probe or to address environmental noise and then continue the test when conditions become stable again. The time bar is a progress bar to keep track of the test time. The test will last a maximum time of 60 seconds. The test will conclude when the test ear has met the criteria for a pass result or the maximum time has been reached.